Have you ever suffered from pain on the backside of your elbow here? A lot of people refer to it as tennis elbow. Well, we're going to talk about exactly what that injury is, what are some differential diagnoses, and what can be done about it. Hey, I'm Dr. Gouveia with HealthFit Chiropractic. So a really common presentation that we see in the office is pain on the backside of the elbow here that can get worse with sport or tennis, as it's aptly named. Well, when we first see that patient in the office, what we have to determine, is it truly tennis elbow, which is an irritation of the tendon right here on this side of the on the arm, or is it something else? One of the most common causes of pain on the backside of the elbow itself is actually referred pain from the neck or an entrapment of a nerve. So that's the first thing that we have to rule out. Second, what's aggravating the elbow? Is it actually playing tennis? Is it gripping stuff? Is it, making a fist, working out? We'll figure out exactly what are the root causes of this pain, help eliminate those or tweak them, and then address the future issues with it. We'll also go over some of the treatment options that we have. If it's true tennis elbow, we're going to do soft tissue work on it. We're going to provide some corrective exercises. However, on the other hand, if it's actually something coming from the neck or a peripheral nerve entrapment somewhere down the chain, sometimes it can be in the shoulder or in the elbow itself, we'll also show how we can address those. So if you're experiencing pain in the outside of your elbow and you think you might have tennis elbow, come on into HealthFit. We'll talk about, is it truly tennis elbow, and what are some solutions we can offer for you. Okay, so we're concerned that our patient might have tennis elbow, but I also mentioned earlier in the introduction that tennis elbow can be mimicked by some cervical pain or referred from the neck itself. So the first thing I'm going to do with any patient that comes in with arm pain or what appears to be tennis elbow is I'm actually going to take them through some neck tests. We're going to challenge them in all different directions, going both ways, applying some downward pressure, whether it's forward or extended. If any of this stuff reproduces that arm pain, let me tell you, it's not tennis elbow, no matter how much it feels like it's tennis elbow. I don't care if you're a tennis player. We have to make sure that we address the spine first. Once we can rule out the spine, let's talk about what it is if it's true tennis elbow. Well, in true tennis elbow, you're actually going to have pain right here on the outside of the elbow. It's typically from overuse. In our amateur tennis players, it's probably going to be from a bad backhand. So when you're actually going into a backhand, you're extending your wrist like that. In our pro players and our higher end athletes that are well trained on technique, they're actually just going to be overuse. If you do this motion enough times and you load it, you have a tennis racket in your hand, you can cause inflammation or tendonitis over that tissue. So it does actually happen from tennis, but obviously it could be any other type of sport where you have extension in the wrist. But even so, you can also get it from really gripping hard. So if you're weightlifting, you find that your wrist is an extension and you're really gripping that bar, you'll find that you can actually irritate that tendon. Okay, so it's not nerve involvement. We ruled that out. What are we doing now? Well, the first thing that we want to do is we want to figure out, okay, are there some trigger points? Are there some adhesions in through this muscle? So we're going to actually have the patient first resist inflection here. And go ahead. If this aggravates it, now all of a sudden we know this muscle is contracted and it's probably coming from one of these muscles here. We'll take it through a position just like this, where we're pinning it down, we're lengthening it, and we're going to extend it. And you'll feel a good stretch in through there. This can be a little bit uncomfortable, but it'll really make a big difference. We can change the angle of it just to get to the different muscles as well. There are a ton of different forearm muscles that are involved in this. They all insert on the same bone here and splay out. We have a bunch of different moves that we'll use to actually treat that. Finally, sometimes, so that's more specific. I like to get my thumb in there, work through that tissue, but also we want to create some local blood flow to the tissue. So we'll use something called a Graston tool, which you may have seen before. We use just a little bit of an emollient here. This is not a treatment cream or anything like that. It's really just going to help make the tool glide over the tissue. And we're going to work through it. I like to just start slowly as we try and actually increase the blood flow. As the patient can tolerate it though, I'll support them. And what I'm going to have you do is I'm going to have you just start an extension and slowly you're going to flex and extend that wrist. So I like to actually have that tissue slide underneath my tool here. I find it's a lot more effective than just kind of working through it with the tool alone. These conditions also respond really well to our cold laser, which we'll show you later in the video. And then we're going to go through some stretches that we'd want to use on this tissue here. The final thing that we're gonna do is, and everybody's different, so I'm not gonna show an example of it, but oftentimes if we have a problem here from overuse, there's a problem in the biomechanical chain. What does that mean? Maybe my shoulder is dysfunctional, doesn't move very well. Maybe my upper back is locked up, and so all of my force load is going on my wrist. There's usually a reason that we're developing increased chronic issues in this elbow, and it's not directly at the elbow. We want to look above, potentially even below the chain to determine, okay, what's causing this? So we can treat it, we can make you feel better for a week, but if we don't address those actual bigger picture issues for each individual athlete, then we won't keep it away. And that's gonna be our next goal in our phases of care. Okay, so when we're dealing with lateral epicondylitis, tennis elbow, as we discussed, there are a few things we have to start to do once it begins to get better. We talked about all the biomechanical analysis. Again, that's very individualized. That's gonna be based on what we see in our exam. But what we also wanna look at are, okay, what are some things that we can do for the tissue itself? These TheraBand flex bars are a really useful tool, albeit they're one of the more confusing tools for patients when we're trying to explain how to use them. So we're gonna do our best here with Jesse to show it. I'll demonstrate first, but what I wanna do, we're treating the right arm. That arm comes neutral. You're then gonna take your other hand, put your wrist into extension, and you're gonna turn. Why this is key is because we don't wanna actually be actively revving it, picture you're on a motorcycle, because that's going to contract the tissue. We're trying to do what's called an eccentric contraction, which is resistance as we go into extension. So how does that work? Arm like that, extension. We're using our good arm to flex the bar, and now all we're doing is resisting the bar's motion into extension like that. So go ahead and try that. So your right arm is gonna hold it. You're gonna take your left arm, yep, and bring it down. You're gonna flex it here, good. And now this arm's gonna slowly release, working this in what we call an eccentric contraction. This is really, really useful for tendinitises or tendon issues. Good. Slowly letting these muscles restrict that motion, really, really useful. The other thing that we do is we show some stretches. We just want to go into extension like this, really stretch the tissue. You can rotate the hand both directions. So Jesse, go ahead and do that for me. And you want to feel a stretch in the forearm there. Really loosen that tissue up as it tightens up after your sport. It starts to pull, cause more inflammation. We've got the cycle going again. The last thing that we use in the office here is we have what's called a Class 4 cold laser, which is a tool that's extremely valuable for any sort of tendon issues. Yeah, we'll keep treating that right arm. Okay. We really just shine this laser light, which operates at a wavelength that the cells or the mitochondria of the cell, the powerhouse, if you guys remember, grade 9 biology, it helps those mitochondria actually respond to the light and create more energy in the tissue. That energy actually helps with the repair. And so you may not feel a thing. Some people will feel a little bit of warmth depending on how close we are to the skin or how high the settings are. But beyond that, this is just gonna stimulate a cellular cascade, which you don't need to know the details of, but is a really, really effective way to treat tendinitises and tendinoses. And obviously, this is what we're dealing with here with tennis elbow. We'll do a full treatment session, which can range anywhere from 4 minutes to 10 minutes, depending on the region in the body. Bigger regions need more time. So an area like this, 2 to 3 minutes is plenty to actually cover the whole area. And that's gonna also help with the inflammation. It's gonna help set this on the right course and get you better and back to your sport sooner. Okay, so now that we've discussed the different types of injuries that can cause pain on the outside of the elbow there, if you feel like you're suffering from tennis elbow, if you feel like you're suffering from potentially a nerve entrapment like we discussed, give us a call at 561-997-8898. Schedule that same day appointment. We'll go through a full thorough exam, give you the answers you need, and get you back to whatever you're trying to do, whether it's sport or just live life pain-free.